IVF is a different way of conception than the normal sexual intercourse. IVF has been used for treatment for infertile couples like nearly 40 years. So this is not a new treatment, and the long-term and short-term consequences of this treatment are quietly safe. The first baby born from IVF was on 1978. We know and we keep on checking all the children born from IVF treatments, and we can say that these children are quite healthy. There are only some risks regarding the preterm birth, low birth weight of the babies, and some minor congenital birth defects. Some of these are related with epigenetics. As a result, we can say that IVF babies are quite healthy regarding their physical and social attributes, physical and mental health, compared to their normal counterparts. The last step of an IVF treatment is the embryo transfer. If the plan for transfer is the transferring of two embryos, then there is a risk of having twins or more order multiple pregnancies. Multiple pregnancies are the major risks of IVF treatments. When we achieve a multiple pregnancy with IVF treatment, the risk comes with preterm birth. It's like 50% at twins and more than 50% in triplets. And when we have this kind of treatments with twins, the risk with preterm birth comes also with low birth weight of the babies. If we have only one single embryo transfer, having a twin baby at IVF treatment is less than 1%. So the major risk of IVF is having multiple pregnancies and multiple births. IVF procedure is not painful for the patients. There are 4 steps of an IVF treatment. At the initial step, we only do the ultrasound with transvaginal ultrasound probes, and it's not painful. The second step, egg pickup, is performed with some special needles. But at this step, we use sedative analgesia and anesthesia in order to have no pain at the procedure. At the third step, embryo production, that ends up with embryo transfer. The transfer is not painful, but if the patient asks to have some sedatives, this can be more comfortable for the patient, but usual embryo transfers are not without any anesthesia. So as a result, we can say that there will be no pain for you during the procedures at all times. IVF treatment is a safe treatment. The only risk with ovarian damage in IVF treatment is the ovarian hyperstimulation syndrome. In ovarian hyperstimulation syndrome, there are some risk groups for this syndrome. If the woman is lean with very low weight, if the woman has polycystic ovaries, or if she is having high AMH levels, then there is a risk of growing many follicles. At many follicles, at the end of egg pickup, there can be a complication called ovarian hyperstimulation syndrome. In this syndrome, body fluid leaks into the abdomen or the thorax, and this might be risky for the patient. But there are some new protocols which enables us to keep you safe from this complication. And with analog trigger of at the end of stage of the ovarian stimulation syndrome, the risk of having an ovarian hyperstimulation is like less than 1%.